So, hold on, what is that? December 8th meeting of the Sawyer County Health and Human Services Board. Let's do a roll call vote so we can make sure that everybody that's not here can still hear us, and we can hear them.
Read out the names
Oh, I'm sorry.
of the board members.
Okay, so I've got Chuck Manhattan, Maureen Bouget.
Here.
Well, let's wait for them.
Oh,
to-
I'm sorry.
Here.
Okay, so Chuck,
Here.
Chuck, can you hear me?
I can.
Chuck Van Enten, are you here?
I am.
Chuck, we can hear you.
There's
There's not a problem with you.
Yeah, let's see. I can see the through. Okay, we can actually hear people, so.
Okay.
Okay.
So you can't hear me at all?
There we go.
Oh,
There we go.
got it.
We will.
There you go.
Yeah.
Hello, this is Mike Bubb from Taylor County.
Go ahead. No, go ahead.
Okay, Jennifer Bornick? Not here. And Carol Pearson? Not here. Lorraine Bouget?
Here.
Reed Schumann?
Here.
Dale Olson? Dale, was that you?
And he's here.
He's here, okay. John Pettit?
Here.
Dr. Sabrina Lund Dunlap?
Yep.
And Dale Slater?
I'm here.
All right.
And let record show that Carol's excused because she's not feeling well. AB and agenda. Any changes?
No.
Right on. Audience recognition. Anybody wishing to speak or something other than what's?
I'm sorry. Did you say?
Audience recognition. Does anybody in the audience wish to address the board? State your name, stand up, please.
Lori Taguma.
Lori, you talked earlier yesterday.
Yep, we did.
I told you I wasn't going to let you speak tonight because your only recourse is an attorney and to take it through the court system.
I was here 2 months ago and you said to put myself in the agenda. So I tried to, and you're not getting the correct information.
But I
You're
told you
basing that-
yesterday on the phone that you've been
Right.
cited. The sheriff assures me that you have received citations. And I told you not to come tonight because your only recourse is through the legal system, not this board. We have no power over your concerns.
2 months ago, you did not say that. And
That's
yes,
right, I sent it yesterday to you.
and you're basing that on incorrect information.
I'll trust the sheriff's word. So would you please sit down or leave.
Yeah, I will definitely just watch. You're basing that on incorrect information, and that is wrong.
It's time for you to leave. Okay, anybody else from the audience?
Joe Bono.
Just here to sit in as a citizen.
That's fine, thank you.
We do have one more, Joe Bono.
Okay, Joe,
Okay, hang on 1 second, I'll bring it in.
Hello?
Yeah, we can hear you, Joe.
Okay, thanks. I'm addressing this committee as a Sawyer County homeowner and taxpayer since October of 1982, a resident and voter since May of 1988, and a concerned citizen who happens to be employed by the county for over 30 years. I ask that I do not meet with retaliatory actions for what I am about to say. After viewing the online account of the November 4th Administrative Committee meeting, I was taken back by the disparaging remarks as to HHS staff, administration, supervisors, remarks of pink elephants, 30-year employees, of which I am one, etc. Board members' inferences of blame and inept leadership, all under the smokescreen of morale and retention concerns. At one point, a board member asked the county administrator in an open meeting, "Who fires you?" And for what? Fear and intimidation or theatrics? As a member of the Winter School Board for over 10 years, I cannot imagine asking a district administrator in an open meeting, "Who fires you?" And if I did not know that answer, I would relinquish my seat on the board. And discussions of exit interviews with disgruntled employees without supervisor accounts, and why interviews for certain peoples only. Recently, a 33-year employee retired in good standing without any interview whatsoever. Nothing much to say to him except, don't let the proverbial door hit you in the, and you know what. That is, after 33 years of employment, that is disgusting. And again, you talk about morale and leadership. I suggest, if you are truly concerned, that you anonymously survey employees. The recent plethora of email exchanges within the county following that November 4th meeting and the decisions on the HRA, okay, surely speaks for itself, and the dissatisfaction even among some of the most soft-spoken, loyal, good soldiers of the employees of this county. Not everybody will speak out, but there were a lot that did at that time. And then the gag order was placed on them, the threats of fear and intimidation again, and for what? Talking about morale, talking about retention. In conclusion, the value of this county is not brick and mortar. It's not measured in courtrooms, programs, property, or trees. The value of this county is in its people and services provided to them. So if you value the people of this county, you must also value those who serve. Thank you very much.
Okay, next on the agenda is minutes from the previous meeting. Has everybody looked at them? And I'll call for a motion to approve.
Say again, sir?
Has everybody had a chance to read the minutes from the November Sawyer County Board of Health meeting? And I would ask for a motion to, this is for the board members.
Motion to approve.
I'll second that.
We have a motion and a second. Everybody in favor, say aye.
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 Motion passed. Committee reports. Is Elaine here?
Lorraine.
Laura?
Lorraine, yep.
Yeah,
Yeah, well, there you are, I'm sorry.
yeah, I'd like to give a couple updates. We are, our men's shelter, we've reached its capacity, so now we are growing. We are able to house, I think, 4 to 6 more individuals where we are at now with their shelter. We are going to be moving our women's shelter, separating it from Oakwood Haven, because I think there's 2 separate needs. We were trying to work things to have a bigger facility, but we're gonna have to separate those programs so that we can meet another need in our community with the families and the parents, preferably the mother at this point, and then have the domestic piece separate. So we're gonna be making some changes there. We're in the process of doing that. We are continuing those efforts with Jack Links. We had another meeting with them today. We are exploring ways for transportation to help individuals who will be possibly looking for employment within their company. And we are going to try to assist many of our members as we can. So we are still pursuing that. And they need the workforce. We have the workers. We got to make the connection. The other piece with our childcare, we're coming to the end of the construction piece. That we're working on programming now so that we can have the program begin operation once the construction is done as soon as we can, so we can provide that service to the people. And that will be tied into with all the departments and facilities that are looking for workers. So Jack Links will be part of that too, if they can use that. We had, we continue to grow with our clinic staff so we can continue to provide the best service we can to our people. And during this whole pandemic, we've been dealing with a lot of mental health and addiction, and we continue to do so. In fact, at this point, we've lost more people to addiction than we have the pandemic itself. So we are still building on the services. We're trying to reach as many as we can. And like I said, the last time we've had added on to some more of the inpatient treatment facilities to help those who need that care. I'd like to give an update from our public health officer to keep things going. I know we have a piece of that later in the meeting, but we had 27 active cases of COVID-19 as of last week. All contact tracing was done in a joint effort between Sawyer County Health and LCO Health Center. We've been working closely together in a partnership through this whole pandemic, and we continue to do so, and we appreciate all that effort. LCO had 2 positive COVID cases test yesterday, and those were within our clinic. These individuals are in isolation quarantine, and we have done contact tracing for these incidents. We tested all employees of the health center today in an effort to allay any fears of contamination in the health center. So we reacted real quickly once we were aware. We got the Thanksgiving holidays, people were hunting, all these things were happening. So we need to continue to put forth all the efforts we can to slow that curve down and to keep as many people safe as we can. And then although COVID-19 cases are declining across the state, data indicated a surge in cases in November due to Thanksgiving gatherings. We can expect to see another surge in January following the Christmas holidays, unless we continue to follow the CDC guidelines of wearing masks, avoiding gatherings of 10 or more, social distancing, washing hands, sanitizing. LCL Health Center planned ahead and purchased an ultra cold freezer to store the Pfizer vaccine. We did this months ago, back in June, to prepare for what was to be coming down the road. And IHS has scheduled our initial delivery of the Pfizer vaccine for December 14th. We will not begin that the vaccination process until we get the approval from the emergency authorization when that piece is given. We are expected to get 60% of our phase 1, because we're going to be doing things in phases. Identified need will be about 60 vaccines, starting with our health providers. Leadership, essential people, our elders, those, so we're going in, we haven't finalized our priority list, but we're working on that. So this is why we are prioritizing the vaccine distribution, following the CDC guidelines within the tribe. We're going to be working on that as we go along. So he wanted me to present that update, and Tweet, if you'd like to add anything.
I guess just about the vaccine and the implementation of that. We're planning for doing that a couple days a week at the clinic, and actually closing our clinic and making it vaccine only for those 2 days. And I know there's a booster, right, doctor, 3 weeks later, I think. And it's pretty timely when you get that second shot, I heard. So we're just the same people that get the shot the one day are going to be scheduled immediately 3 weeks later for their second shot. And we're going to run them through the clinic. So, and we do have, with this freezer we purchased back in June, we have the capacity to hold many, many doses.
Yeah.
We could provide probably Sawyer County's, Julia, you've probably been in touch with Gary on this, and we have capacity in this special freezer to even hold what Sawyer County might need.
Yeah.
So
Yes, I have shared that with our emergency management teams.
Yeah. So that's very important. We're planning for that, and like Lorraine mentioned, we're prioritizing our elders and our healthcare workers to get the shot first. But we are anticipating some people maybe won't want to get the shot because it's brand new, and some people are concerned about it.
Yeah.
But we're not going to force them, but we're going to offer it. So and that's the plan.
And we've been watching closely with the schools, watching over where those outbreaks are happening, trying to keep the kids safe, families, everybody. And we're going to continue to do that. So the college, when it went virtual, they're looking at now, looking at second semester, we're going to extend it or not. We're watching the little ones. They are now closed virtual. The schools are trying to operate safely if they can. Again, close when we need to, so we have things in place to keep our people safe. And we are trying to keep building on our programming across the board. Like we said in the public meeting that we had, we have to survive too financially. So we try to operate as much as we can, but as minimum and safe as we can. So that's where we're at right now.
Thank you, Lorraine. I apologize for calling you by the wrong name.
Oh, that's okay.
I'm terrible at names. Does anybody else have any questions? Lorraine?
When is the public commentary section? I'm a member of the public, and I just don't appreciate the way you cut me off just now and not being able to speak at a public meeting.
I told you why.
Yeah, that was convenient that happened in just the past couple of weeks. And this is a very important issue that I have to present.
But this is the wrong venue, so
I've been
please
here
be
twice
quiet.
now.
Chairman, Leader, can we ask who is addressing the committee? Since I cannot see the individual and I have not heard the name of the individual.
Sorry to get on. I was told 2 meetings ago that I should put myself in the agenda, that there's a 5-minute public commentary period. And in the interim, Mr. Schleter referred to the Sawyer County Police as giving me a ticket, which was wrongly given to me.
This is the wrong venue, and I'm not going to debate this issue with you. You will either leave or we will have you escorted out of the building.
So I'm a member of the public and I can't comment for 5 minutes. That's wrong.
Can you contact the sheriff's office?
What's going on here?
It's public health.
Tom, can you contact the sheriff's department, please?
Okay.
Oh, that's just really wonderful.
What happened?
I got a quick question. Whether this is the right form or not, why can't she speak?
Exactly, thank you.
Because her only course of venue is the legal system. She has been advised, if she wants to pursue this, to get an attorney and take her complaints through the legal system. The Sawyer County Board of Health has no jurisdiction over anything concerning her issues.
But correct me if I'm wrong, if the public wants to speak, no matter what the topic, they get 5 minutes. And if this isn't the forum and she needs to go to another avenue, that's fine. But I don't think we can limit what she can say and what she can't say because she's part of the public. And I don't think we can make her leave a meeting.
Exactly, thank you.
It's 3 minutes and at the discretion of the chair.
Yes, it is, and this
Yeah.
is not an issue that has any bearing on Sawyer County Board of Health.
Okay, so we should
And the
move on.
reason I'm asking the sheriff deputy to come over is because she was interrupting this meeting and refuses to sit there quietly. Okay, Senior Resource Center, is anybody?
Yeah, I'm here. I'm just going to do a brief report just to kind of bring the board up to date on some things that are happening. In the last 15 days, the Senior Resource Center has received over $20,000 in donations. One of the donations was almost $20,000 split between Meals on Wheels, our respite program for 2021, and for the new bus. And besides that, probably another $5,000 has come in the last 3 or 4 days, some of those donations up to $2,000 have been anonymous. They do not want, anybody to know who gave them the money. We are also working on our emergency plan, and we're doing that in conjunction with the ADRC, because if the senior center in Hayward would have to close, that would be 11 employees, 500 meals per week. So we are in the process right now of working with suppliers to put together 1,200 shelf-stable meals that would supply both the Hayward site for 10 days, Winter and/or Exelon and Stone Lake, if any of those sites had to close. If Exelon, Winter, or Stone Lake had to close, each of those either have 1 or 2 employees. If Hayward was still open, employees from Hayward could go down and run those sites. But if Hayward closes, that would mean our upstairs and downstairs would not be able to work. So we're working with a couple of substitute cooks and some staff of the ADRC that would be willing to come in and distribute those meals to the Meals on Wheels drivers. So that's what we're working on right now. I just wanted to update the board on especially the $20,000 to $25,000 worth of donations that we've gotten in the last 10 to 15 days, with one donation of almost $20,000 from one person. And if there's any questions that anybody has about the senior center, what's going on, feel free to ask your questions.
Any questions for Joe?
I guess I do, Mr. Chairman. Joey, are we operating the Winter site currently? Is that
Winter has been, Tweed Winter has been combined with Exelon. The meals are being cooked in Exelon, and Bill Appleby goes every day or so many days a week. He goes to Exelon, picks up the meals, takes them, meets the drivers, takes the stuff back, and then we have another driver that does that another 2 or 3 days a week. The meals in Winter right now are running anywhere from, they could be 7 to 12 meals. It just depends upon, and we only have one carry out. So it wasn't feasible to run a site, keep it open. We've actually probably saved $2,000 to $3,000 a month since we combined the 2 sites. And then the other thing with combining that sites, the second cook at Exelon, we're able to train her to be a site manager. So it's very possible that when we do reopen Winter again, that person can go to Winter and be the site manager there. And that would, eliminate us from having to hire someone else and train someone. They'd already be trained.
Any more questions? All right, then, on the advice of our corporate counsel, I have been suggested to me that I change my mind and allow Mr. Gilmer to have 3 minutes of public comment.
Why don't you come up here and sit down on the microphone? 3 minutes.
Thanks, the board, for hearing what I have to say. As I mentioned earlier, I was going to publish this, but you feel the full effects of what's going on at our house. So if you don't mind, I'm going to focus on it for a couple minutes. We're dealing with an ongoing harassment issue, ongoing elder abuse, disputes and elder abuse judgment from the tribal court, and we have 8 years of harassment restraining orders for these neighbors that are now harassing us with these utility lights that are shining directly onto our house and our windows. And they are making us sick. They are commercial utility lights. They're not made for residential use, and they're doing it on purpose as a continuation of their harassment. It recently killed my dog. She was throwing up for 3 months at night, projectile vomiting. As soon as these go on, and now they put one on an 8-foot pole, and there's one underneath it as well. And yeah, isn't it annoying? It goes directly into our windows, 13 hours a night. And I mean, we put up all the cover that we can to protect ourselves, but to kill my dog, it's going to kill my mom, and it's going to kill me. And people have made it, I don't know, a personal issue. It's not personal. It needs to be a public health issue. And we are asking for this board to address it and to enforce some sort of policies. We have multiple statements from other people that say this is killing these people, meaning us. And it is a direct harassment by these two families. Now there's two families doing it together in tandem. And the other family has a wedding like this, but they're rewired to be about 1,000 times brighter than it should be, and it's radiating from the other direction. And it's just killing us. And we've asked them to take it out, we beat them off from other lights, and they don't. They say they want things on us. So we're asking this board, I mean, there's multiple statements from people speaking to the effects. And we also have the survey that we've done of our yard. And it shows where the light comes from and where it goes to. It goes directly into our windows all night long. So we're asking the board to enforce the residential light policy, or to make a policy that enforces safe residential lighting. Is that possible?
Well, that's on tribal land.
This is public comment only, so she can make comments and we,
Oh,
yeah.
okay. So here are two statements from different people that speak to the effects of this lighting. It makes your skin crawl, it makes your heart race, and it makes your heart actually palpitate and misbeats, and it gives you searing headaches that will give you a stroke sooner or later. It makes our blood pressure go up to 185 every single night, and then back down to 130 in the afternoons. It killed my dog. It's going to kill my mother and I if no one steps up and helps.
Your time is up now. I've got more than 3 minutes.
That was really fast. But thank you all for listening. And if anyone has any questions or would like to help me and my mom, we'd appreciate it very much. Thank you. So thank you, whoever decided to give me 3 minutes. I appreciate it.
Next on the agenda is behavioral health.
I'll start it off.
Excuse me, Mr. Chairman, did we have a 8 or 5B, the grant resolution 2021? Did we do that everything?
You're not on the right agenda.
Oh, okay. Oh, okay. No,
You're
I
good.
didn't. Sorry.
Please proceed, Paul.
During the last board meeting, there was a CCS discussion, and you asked to have that discussion continued during this board meeting. After the conclusion of our board meeting and listening to the administrative committee board meeting, it was really clear to me that the answers that Alicia and I are giving the board don't appear to be satisfactory to the board. And so Alicia and I reached out for some help to hopefully help the board achieve some clarity in this regard. There have been a number of meetings this week trying to put the agenda together, and there were a lot more discussions going on than I anticipated. So I have I'll introduce the guests in a moment, but they're here and they can serve any purpose you want. If you have questions, you can ask them questions. They're also prepared to give you an overview of CCS, including NCR. Again, NCR is the North Central region, which we belong to, along with Iron County, Price County, and Taylor County in our CCS region. They're also prepared to talk about collaborating with Sora County, what that's been like. And they're also prepared to talk about CCS resource challenges, including service facilitators and therapists. And I've also asked them to comment on, because it's been in an email thread this week, comments again about using CCS for diversion. And I'd like to get some clarity about what exactly CCS can do regarding diversion. And I'd like everybody to hear that so we're clear and we don't run into something like we did a couple of years ago when we had like a day-long meeting regarding this issue. Okay, so the people that we have invited, first is Cheryl Kettlehut. She's from Taylor County. She's the CCS coordinator and the NCR CCS administrator. We also have, I hope he's on, we have Langston Hughes, who's from DHS. He's the Comprehensive Community Services Coordinator, Bureau of Prevention and Treatment, and Recovery Division of Care and Treatment Services. And if that's not a long title, I don't know what is. And then we have two board members, Taylor County board members that have agreed to participate in this meeting tonight. One of them is listed here, the other one isn't, and I'll introduce him in a second. So we have Scott Milbrand, who is a Taylor County Board Supervisor. He serves on multiple Taylor County committees and boards, including the Human Services Board and the NCR CCS Coordination Committee, which, by the way, our CCS Service Director, Alicia Carlson, has been entrusted to be the chair of that committee. And also we have, and his name's not on here, but we have Mike Bubb. I think he introduced himself before. He's got a nice Badger outfit on tonight. He's also a Taylor County Board Supervisor, and similar to Mr. Milbrand, he also serves on other boards, and including the Human Services Board. So,
hi everyone. Thank you for the invitation to talk with you tonight.
Hello, everyone. This is Scott Milbrand. I appreciate you giving me the opportunity as well.
And we're getting the Langston hooked up so he can speak. Now, I don't know what the board's pleasure is. If you want, there he is. If you want to ask them questions or you want them to talk about some of the topics that I mentioned. You know, if we want to defer to Tweed. Tweed has been very, very heavily involved in this agenda this week. So,
yeah, I guess I'd like to hear their opinion on our predicament, you know, without being able to find a service facilitator that's going to stay with us. So I would like to hear their opinion on their experiences and how they've overcome this.
I too would like to find out how it's working in their county and why can't we make it work in this county?
Yeah.
What is it that you're trying to service by receiving or replace?
It's a program called Comprehensive Community Services, and it's for people with behavioral health issues. It's people that, there's a real intensive program called the Community Support Program for chronically mentally ill people, and they have intensive contact throughout the week. And then we also have people with behavioral health issues that would be mental health and substance abuse that can get by with coming into outpatient therapy maybe once a week or once every other week. And then you have this whole group in the middle that doesn't need the intensive service of the community support programs, and the outpatient therapy isn't enough. So there's a program called CCS. That's what it does. Okay? Comprehensive Community Services. Okay. So, Cheryl, would you like to start?
Sure. Thank you, Paul. Taylor County started with the, is it okay if I use the letters CCS? Are people comfortable with that?
Yep.
Yes.
Okay. Taylor County started in CCS in 2014-15. At that time, I was only involved on a part-time basis, having supervision in other areas. When we first applied, we were in what's called a shared region. There are 3 models for the CCS programs throughout the state. One of them is each county doing it on their own. One of them is a shared region, and one of them is a multi-county region. A shared region, each county does their own billing, but they'll share resources. They may have a psychiatrist in common. They have policies in common. They operate in a similar way. They may share certain staff or certain supervisors. The third model is how we currently operate, and that's a multi-county region. So Taylor County started out as a shared region with Iron County in 2015. In the end of 2016, when we were reapplying for certification, it was decided that we would become a multi-county region. And the reason for that was because there were limited shared resources. So in order to serve the most people that we could in both counties, it made sense to go to a multi-county region. That was obtained in 2017. So we were a 2-county, multi-county region. Then during 2017, our then director, Tammy, she approached Price and Sawyer County, who did not have the Comprehensive Community Services Program, about joining us and becoming a 4-county region. And as a 4-county, multi-county region, Taylor County would take the lead. That means that all billing goes through us. All quality assurance and policies are held here. Taylor County develops the contracts with providers, although providers can serve all counties in the region. That was entered into in 2018. Beginning of 2018, there is an MOU between the 4 counties, and we continue with that. When we started, our goal was that we would have a 2-year certification. In order to get a 2-year certification, each and every county needs to be performing at a top level. It means that each of the counties is aware of what CCS requirements are. They are instituting the necessary procedures, both billing and program-wise, to assure that the program is operating in a manner that is both approved by medical assistants and approved by the Department of Health Services under the guise of Chapter 36. There are 2 major departments at Health and Human Services in Madison that carry the guidelines for the CCS program. In order for someone to be enrolled in CCS, they have to have medical assistance, Title 19, Medicaid, Forward Health. Those are all terms for the same program, medical assistance. And then they have to qualify according to what we call a functional screen, which means that their mental illness or substance use disorder has to have an impact on their life in certain areas and at certain levels. So that we enter that data into the state database, and that will tell us if somebody qualifies or not. So Medicaid gives us billing rules that we must follow. Langston's unit provides Chapter 36. DHS Chapter 36, which governs the rules of the program. That says what qualifications people have to work, what needs to be in our documentation from a clinical perspective, not a financial perspective, but from a clinical perspective. CCS is a clinical program. Going back to medical assistance says, okay, this is what you have to have in each and every document in order for it to be billable to medical assistance. So in 2014 or 15, Langston, correct me if I'm wrong, the state said the state legislators said we would like to do an audit of the CCS programs that are operating in the state. And the reason for that was they made new Medicaid rules that said CCS is a cost-based program, which means instead of being reimbursed at the standard Medicaid rate, we are able to get 100% reimbursement. So the state wanted to assure that practices were being done in the right way. The Office of the Inspector General is the auditing arm of medical assistance. So they went across the state, and I don't know how many counties were audited. Langston may be able to provide that information, but there were severe deficiencies found, and counties had to pay back hundreds of thousands of dollars because they were not following the Medicaid rules. They may have been following the rules of Chapter 36, but they were not following the rules of Medicaid. Taylor County, Iron County was not a part of that audit. However, we learned from that, as did all programs within the state. Following that, there was a work group established throughout the state. We met in Wisconsin Dells. There were people in all different kinds of CCS programs. There were people from Dane and Milwaukee County. Little old Taylor County was there. I believe Ashland County was there. La Crosse, Green Bay, and some other small counties across the state. There was a very good representation of both rural and urban areas, as well as areas where there was a multi-county region versus one county alone. We sat down and we dug through and tore apart Chapter 36 as well as the medical assistance guidelines to come up with an agreement with what the requirements were for CCS as far as documentation is concerned. The major reason why counties had to pay back money was in the detail. Signatures weren't where they needed to be. Dates weren't what they needed to be. It was in the minutia of the details that MA said, we want our money back, basically. And like I said, there was hundreds of thousands of dollars that had to be reimbursed.
Yep.
From that, I'm sorry, Langston, did you want to add?
Well, actually, what I was gonna emphasize, Cheryl, is that the things that counties and tribes, and actually the only tribe that was involved at that point was Lac du Flambeau, the things that they got caught on was a lot of real basic things. No signature on the treatment plan, incomplete documentation here, no date here, no signature from the program participant or the client. I mean, a lot of really basic things. And what's even worse is that all of the counties that came into CCS, if they would have read their contract and what CCS was all about from the beginning, they would have realized, which it clearly states in DHS 36, that you have to have a quality assurance and quality improvement system in place. Nobody had a quality assurance and quality improvement system in place. Therefore, they got caught. The documentation is one of the biggest things that will trigger an audit. The lack of good quality documentation will trigger an audit. It's just that simple. When documentation is submitted and billing is submitted to MA, If they see something that doesn't look right, doesn't look normal, they have every right to say, let's go take a look. So it's critical that that documentation is looked at very closely, with the critical eye, because that is one of the things that will trigger an audit.
So based on what Langston said and what we found at the meetings that were held in the Dells, a tool was developed. It's called a quality assurance tool, where every single file is looked at by CCS staff to make sure that documentation is in place. As the lead county, we are responsible for implementing those things. So Sawyer County, Iron County, Price County, and Taylor County staff have all been trained to watch for those details. And if the details aren't there, to take them to the person who created that documentation to make the necessary changes before something is submitted for payment to medical assistance. CCS is an extremely detail-oriented program. It is absolutely necessary that the person supervising the CCS program in Sawyer County be detail-oriented and be able to know when things have to be corrected and to be able to approach those things with the employees. I feel as though Alicia and other staff at Sawyer County are extremely skilled in doing what they do. We too have had some retention issues with the program. Price County has had some retention issues, and so has Iron County. So Sawyer County is not alone in that. What makes it more difficult is that in a rural area, we do not have the availability of people, professionals, to apply for the jobs that are needed. I can speak for Taylor County. We were looking for a therapist for 18 months before we were able to hire someone as a therapist. That was about 4 years ago, 5 years ago, maybe now. And that person works in CCS. Her name is Lori Hoffman. And she is one of the best CCS service directors that we have. And she has trained all of the other service directors to be as detailed as she is. We then looked for another therapist as we had a resignation. And it took 6 to 8 months to find someone. The candidates either did not have the education that was required, or they did not have the experience that was required for the position. That's part of working in northern Wisconsin. In Taylor County, we say we're north of 29. I would imagine in Sawyer County, you guys say you're north of Highway 8 or another highway. That resources are extremely limited. The CCS program in Taylor County has worked very hard, and we have a census right now of in the middle 30s. We worked very hard to obtain that. We can take referrals from anywhere, but the person has to be voluntary, and they cannot be court ordered. That does not mean that somebody who is on probation can't be in the program. It means that CCS cannot be a part of that probation agreement. It does not mean that somebody who is under a commitment can't be in the program, on a mental health 51 commitment. It means they have to be willing to participate in the program and invest in the program. It's a rehabilitation program. It isn't a maintain program. It's a rehabilitation program. People
And therefore,
have to
the
be,
individual has to participate in the services that they agree upon. CCS is set up to help individuals reach the highest level of success in their life and help individuals put their lives back together. And in order to do that, we're not going to do the work for them. We will work with them to develop the things that they need to do to achieve their goals. But we're not going to do the work for them. We will work with them to achieve their goals. And then tie in their natural supports within the community so they can, at some said given point, begin to need and utilize less and less of formal assistance.
Chairman, I got a question for Cheryl. Cheryl, this is Julie Schumann from Surrey County Board.
yes,
Yeah, I've got a question, Cheryl. So Taylor County has a census of 30 consumers, correct?
between 30 and 40 right now, yes.
Yeah. So how many CCS staff do you have for 30? I mean, how many service facilitators? Do you have some, what do they call them, peer specialists, rehab workers? Do you have a number of these people?
Taylor County employs, I have 3 service facilitators. However, being a small county like Sawyer County, many of our employees are in different programs. Part of the time they work in CCS, part of the time they work in children's long-term support, part of the time they work in crisis, helping out with 51 crises. Part of the time they may even work in the children's unit. And part of the time they are working in the coordinated services team. So it's difficult to say how many FTEs we have. What I can say is I have 1 staff who only works in CCS, and the other 2, actually 3 staff work in other programs. So I have 4 service facilitators, not 3.
Okay.
How big a caseload they have is dependent on the services. In Taylor County, our service facilitators do not provide any of the services other than service facilitation, screening and assessment, and case planning. We have contracted providers, as is available for the whole region, to provide the other services such as independent skill development, medication monitoring, employment-related skill training, and the other 10 or so services that are on the CCS services array that Medicaid will pay for. Our average caseload, if they were only working in CCS, would not be any higher than 15. And that's enrolled. That does not include people that they are evaluating to see if they qualify for the program. Sawyer County has, and our other counties actually, each have 1 service facilitator. And that service facilitator also works in other programs.
Cheryl, so you have 1 supervisor for all these service facilitators at Taylor County?
I am the administrative supervisor for them. As far as their CCS clinical work, Lori Huffman is our clinical lead. She is our service director. So she directs the service facilitators in regards to case planning and services and approving those services. She has the same role that Alicia does in Sawyer County, but she does not have an administrative role to directly supervise them. I approve all of the vacations. I do their performance reviews, sign their timesheets, and provide. I supervise CLTS. I supervise Birth to 3, and I supervise the Children's Community Options Program, as well as, and a colleague of mine supervises CST.
Board members, any questions?
I was just gonna add, the LCL tribe also has a CCS program. So we are trying to provide those services also, but it's interesting to hear different things because I'm not really active in the program itself, but I do know we have that department. But when I see certain things, in rural areas, our people are spread out all over, and we're trying to help them best ways we can. But it's disheartening to see we cannot have these positions filled. And I'm not sure, I know there's requirements, there's things they have to have in place. As a facilitator, I'm not talking administration, but as a facilitator, I don't know what kind of salary range there is. I'm not sure if we're offering benefits. I'm not sure where all that is at, but I just wish we can fill those positions so we can keep providing the service. It's very needed in our areas. And I do see it helping a lot of lives.
CCS, if I could take a few moments, I would like to tell you about a CCS success story. May I do so?
Well, I'd love to hear it. I don't know about the rest of you, but I'd like to hear success stories.
Before you do that, are there any board members who have any questions at this point in time? I see you, sir. I'm going to go through the board members first, please.
Well, I guess I just have one more for Cheryl. That's good. Cheryl, this is Tweed again. Of Taylor County's 4 service facilitators, are they all of the same education level and degrees? Or do you have varying degrees?
I'm sorry, I interrupted.
Oh, no, I was just looking at the minimum qualifications for a CCS service facilitator. And I was wondering if Taylor County has varying degrees of people that are employed as service facilitators. We're not looking at that bachelor degree, master degree person. That's really hard to find.
Tweed, I agree with you. The more education that someone has, the harder it is to hire them in northern Wisconsin, just because they're not available. All of our service facilitators in Taylor County are bachelor's degreed. And it probably took them at least a year, if not more, to feel comfortable in their position, because CCS is that detailed. And I can tell you that our service facilitators were extremely frustrated with me and with Lori, because we would be sending things back and having them change things. So what Alicia is doing is exactly what we want her to be doing, because it's vitally important that all of the T's be crossed and the I's be dotted within this program, because we do get 100% reimbursement. And so instead of billing $80 and getting $20 back, you bill $80, and when the initial rate comes in, you get part of that. And then when Patty and the fiscal staff do the WIMCR reconciliation, then the rest of it can come back. So it is a program that will be 100% reimbursed. It is also a program that is a critical component in avoiding hospitalizations and avoiding institutional stays. And how we do that is there's a service plan that's developed, and when someone is having increased symptoms, our service facilitators are able to go in and perhaps authorize more services to help that person through the crisis so they don't have to go to the hospital. They don't have to go to Winnebago and be there for a long time. We are in that home to see what we can do to help to avoid things and to avoid additional expenses for the county. Long answer, sorry.
No, but I think she's spot on, Chairman, as far as our out-of-county placement costs and our runaway budget in that department. So I think ramping up CCS at a local level right here would save a lot in those costs long-term. And I understand where Paul is at, you know, Paul, and this search for staff to fill these positions. So, but I think in the long run, if we can get something set up here, that's gonna save us a ton of money down the road with out-of-county placement, that she just mentioned.
Okay, we ramp up without these positions all being filled.
No, I'm saying we need to keep recruiting and trying to find these people that can get our CCS program up and running. And so we can do the interventions right here and save the hospital or out-of-county placement costs.
Cheryl, could you address I tried miserably and failed last time, to tell the board how important it is to have everything synchronized, everything in place at the same time for this to work. It seems like we plug one hole with a service facilitator, then we don't have therapists. And the service facilitator leaves, and we have a hard time getting the therapist. Could you explain where Sawyer County is at with getting all that stuff synchronized, especially with the therapists in the community?
Yes, it has been difficult to obtain service providers in that area. Therapists are rare. I spoke with Northland Counseling, initially was on as a provider, and they no longer have a provider that is certified with us. I have contacted Carol London, continue to contact her to find out if she has staff. I understand that might not be the case at this point. And we now have a contract with Northland Counseling. We also have a contract with Jody Pettit, who provides some outpatient counseling in your area. That's only a part, yes.
Cheryl, Carol Lund is here, and I think you meant to say North Lakes.
Oh, I'm sorry.
Spent about a half year trying to get them engaged, and I guess they are
Yep.
now.
Yep, I'm sorry. I did. North Lakes is who we have been contacting to provide services. We are starting to get some traction with that and are starting to have response from them. We now have a contract. The next step after a contract is to get the needed paperwork to be sure that the people who are doing the therapy meet the CCS requirements. And so I'm working with the administration to obtain those. But Paul is exactly right. The two pieces that have to be present together are providers and service facilitators. You can't enroll people in CCS without a service facilitator to do the work. But people aren't going to enroll if you don't have providers to meet their needs. So it's kind of a catch-22, and Sawyer County has been caught in that area, where when they have the service providers, the service facilitator isn't there. When the service facilitator is there, then we have difficulty finding providers. I have come up to Sawyer County and certainly am willing to do that again, to recruit more providers. It is something that in rural northern Wisconsin is difficult to do. And to be perfectly honest, there are some providers who do not want to be in CCS and a provider because it is so documentation heavy. And I don't have any control over what's required. I go by what medical assistance says and what Chapter 36 says.
And then gentleman down there.
Just wanted to speak on a few things.
Can you sit in front of the microphone, please? Put that in front of them, please.
Timothy James Puddle, 38 years old, local citizen, born and raised here in Wisconsin. Can you state one more time what CCS stands for?
Comprehensive Community Services.
Comprehensive Community Services. The term comprehend is a shorten that, I have 8th grade education. And I was diagnosed with ADHD when I was young. I was 8th grade graduate, even though I have an HSCD. But in reference to comprehensive or to comprehend the terms, to speak of behavior assessments, and something that I've been a part of within this county and within Health and Human Services, the department here, Joe Bodo, and I believe you have seen as well, amongst others. My recovery and assessing, just my assessment, my assessment has been throughout my life, look at alcohol use and drug use. It's been well documented within the terms, what the norm is or what the expected was. It's been stated for years, but though, for whatever reason, I continued doing what I was doing. I continued to be influenced by what, by what I did and by others. And that influence, as I've sobered, to get back, to speak to behavior, as I've sobered and as I've regained my consciousness and just being attentive to what's going on around me, it's taken years. It has taken years, and it's felt good. Just sitting down and listening to those on the TV, on the screen, and then those of you who hear the response within my cerebral is coming back. I've had a lot of trauma, is a good term to use, and I recovered from it with the help of, I speak of medical coverage briefly here, billing. I've made my argument years ago. I don't feel I should have had to pay for any of that counseling. As far as I'm concerned, every one of you who work for the state, you get paid, regardless. It's a government funded service that you have a salary or whatever it may be, medical services, you all are paid. So billing us, the citizen, doesn't make much sense when you get paid regardless. That's my opinion on that. Free healthcare. That's something that's been working as a government. Reference to service, I've had good experiences with a lot of, as I mentioned, Joe Bodo, and I've seen you before. Mine is.
I don't recognize you with the mask on, so.
No, I hear it. But going throughout the years, I've seen a lot of different people, and to speak to ADHD, if I could change it, which we can't, when I'd like to have one caseworker throughout my life, yeah, I would. I think it would have helped. But I didn't. I had different people, and everyone played a role though within my life. And as I've sobered, I have memories of a lot of those people that helped me rebuild my mind, and regain my memory and my consciousness and my conscious thought to be attentive. So I thank you, those of you who have helped me, and speak on the service provided. I'm not court ordered to go through anything. I was at one time court ordered to go through a mental health assessment from probation, but unfortunately I fell asleep on my couch, and I was still recovering from multiple drug overdoses, and I was very sick and trying to heal while on probation. I was revoked due to an altercation with my stepfather, and to speak to behavior, those charges were dropped. I was arrested, but the charges were dropped. I was defensive, something that me and him have had to go through throughout the years. As adults, we understand one another and care for one another. But as I said, without having a court order and to speak in terms of voluntarily, I'm one of those people. I think I can't remember, Julia Lyons, I think I was speaking. And I'm one of those people who have voluntarily tried to, I've been a carpenter my whole life, and my life seems to have transitioned. My back kind of gave out, or not kind of, it did. With arthritis in my knees, So I've been recovering from that, from those injuries, but I voluntarily continue to seek, I guess, things to do to keep me occupied, to keep me attentive. I mean, my mind has transitioned into my own health, which, you know, to speak to what's been going on, the influence that I've had from those of you. And I continue to pursue this, and it seems like, you know, I brought it here today. And I'm thankful for that. So in reference to, you know, the voluntary work, or those, if you're looking for someone to fill a position, I mean, my history would concern some because of my criminal history, and then my substance abuse. But my knowledge within substance abuse and the recovery process, I think would be beneficial, or Health and Human Services if there was a spot open, you know, for an opportunity for an entry-level position for someone like myself. And that would continue to help with the growth from the outside, you know, without having the court order, as I said, and without having the influence of inpatient treatment, as I did not in my recovery process. I had, you know, basically the audio, or the influence of the spirit. I used to,
Excuse me, sir.
no, I know.
Appreciate your input. but you do need to move on.
Yeah, so I'll make it brief here. With the influence of my surroundings, and you speak to synchronization, and I see the computers here, the amount of influence my mind has been through is a lot, and but I've gained a lot throughout it. And with that being said, I think that you've done a good job. I mean, if I was the one control within an environment, I mean, obviously there's stepping stone, or there's going to be some adversity, and there's going to be some mistakes made by yourself and myself as well. There's going to be attention deficit disorder, and there's going to be, you know,
Okay.
there's going to be problems at times, but over time, it'll correct itself. And I believe that we've shown, you know, and as I show you, and as those of you who I've worked with show me, we've shown progress. And as I said, if I'm one person to make an example out of the influence that I've been through within my recovery, I see positive.
Okay, I really need to get to some other people now,
Yep.
so thank you.
You're welcome. Thank you.
Is there anybody else on virtually here that can
Dale's asking me, Langston, if you have some words you'd like to share, and then the court, and Scott and or Mike. I don't know if the board members have any more questions, or anybody online either.
Does anybody have any more questions?
I'd like to hear the success
Oh,
story
yeah,
at
sure.
some point. Wait, this was one right here.
Yeah.
I guess, you know, I just want to piggyback off what Cheryl stated in reference to the staff there at Sawyer County and their ability to ensure that their CCS program is functioning at its highest level, regardless of the staffing issues. The work that Alicia is doing is based on months and months and months and months of hard work by numerous individuals from across the state that sat down with DHS 36 and the Forward Health Provider Update and went through DHS 36 with the fine-tooth comb and created documents and really broke it down and made it very easy for counties to understand. If you've ever read it, it is a very slow, deep, hard read. For many individuals, they struggle with, what does this mean? What does that mean? Well, that group of individuals took it apart and put it back together and made it an easy read. They also developed that document that Cheryl was talking about, which is a checklist, which is used to go through each and every file once that individual is brought on board. That is your quality assurance system. That is what you need. You need someone just like Alicia at the gate to ensure that that documentation is correct each and every time. And if it's not, he's going to send it back. You want to know why? Because she's protecting the money that comes into that county, that comes in there from MA, coming through CCS. If you don't have someone that's willing to do that, if you don't have a real tough person at the gate to hold people accountable, on some said given situation, an audit will come. And there are a couple reasons that will trigger an audit. An audit will come. And they will look at that documentation. And if it's not at the standards that it should be, that shows that the services that were provided are directly tied back to that service plan, they will take the money back. There will be no conversation. There's no wiggling around it. Oh, please don't take my money. That's not how DQA works. That's not how they work. They're going to ask you to send them the documents. They're going to review it. They're going to find the errors if they're there, and they're going to tell you what their findings are and what it's going to cost you. That's it. I think that you guys are in a really, really tough situation living in a rural area of the state. And, you know, Cheryl is spot on, you know, in the fact that there's not a lot of resources. There's not a lot of people out there that are just lining up to do the work. I mean, I talked to Paul about the number of individuals that actually apply, and he says, we're lucky to get one person to apply. I mean, so when you only have one person to apply, and you need someone in that position, do you give them a chance, or do you just say, no, I don't think you're one for me, and then you have nothing? So what do you do in that situation? You give that person a chance. The one thing I have to say about healthcare, and especially behavioral healthcare, because it takes a special kind of person to work in this field. If you don't have it in you to do this work, don't come knocking on the door. This work is very special. People are not going to be nice to you every day. Your expectations of individuals' behaviors are not going to be met every day. You expect people to come to an appointment because you made an appointment? That doesn't mean they're going to be there. It takes a very special kind of person to work in this field. They have to want to do the work. It's a heartfelt level of work to provide services with someone that is in need. Nurses deal with it every day. Clinicians live with it exactly the same way. Doctors deal with the same thing. It takes a very special person to care about another person, to help another person through their life and help them get back on track. They're not everywhere, but when you find them, they're rare and they're keepers. I'm not saying that you don't have those in your community, but if you do, you need to find them. And if they're good, and if that's in them, they will stay, and they will give you that 110% that you need.
Okay, thank you very much.
Just one more time, you know, we have two Health and Human Services board members in Taylor County here to offer their perspective. Do you have any question for them what their experience is like? I mean, they're here. This is the opportunity. These people have taken time out. They usually don't work this late, especially in the county. They're here tonight. So
I don't.
Mr. Chairman, if I may, I can kind of give my perspective on what we've done in Taylor County, if you don't mind.
Okay, go ahead.
A few years ago, and Cheryl had the exact dates, our executive committee and our county board realized that we did have a problem with long-term commitments. We had problems with drug and alcohol abuse in Taylor County, and the CCS program kind of fell in our laps. It was about the time that started, and we decided at the time that we were going to look into this. And our county board chairman, I can still remember his direction to me was that I should just go and I should just supervise. We required that there's a county board person on our CCS committee. And when I got there, I realized very quickly how precise everything had to be. And I think then our county board did what we generally speaking do. Our system of management is we hire, and I'm not trying to embarrass Cheryl here at all. It started out with somebody else in our human services department that started the CCS program, and we like to hire good people and people that know way more about that stuff than I do, and then we just kind of get out of their way. And we've been really blessed in Taylor County with the previous person, Jen, and with Cheryl, who, I mean, you can just tell by her talk today when she talked to us, she knows this program inside and out, and we're blessed to have that. As far as retention of employees, I guess back in February, before this whole COVID thing hit, our Human Services Board decided that we were going to give it a try to with a little bit more remote work. I think Cheryl remembers that. I think we authorized, even before there was any really talk of COVID, we authorized, I believe, 6 or 7 positions that could work from home. I think that helped with retention. And well, now, of course, COVID's turned kind of everything upside down. So we have many more than that working from home. We'll see where it all shakes out when the pandemic is over. But I don't know, that could be something that you could try. You know, maybe you can recruit someone that way. That's specifically why Taylor County did that. So, and I'd be happy to answer any more questions that I could, but I think Cheryl kind of went over everything as well as certainly way better than I could. So.
Okay, again, thank you. Appreciate you taking your time to give us the benefit of your experience. Thank you very much.
I have a question. Is it a requirement to have a bachelor's for those positions?
I don't think so.
Doesn't the college have new programs there? Is there any effort to go out there and start a recruitment if they got at the ground level?
Well, that's exactly what Langston said. Langston, do you want to comment on recruiting and looking outside the box to find these people that you were talking about?
Yes, I did mention some things to Paul, and I brought it up to Cheryl as well. And I had mentioned it to you as well, Tweed, that there are some things that you may want to consider. You may want to consider looking at individuals that are high scholastics there in your high school that may be interested in social work. You may want to reach out to some of the local colleges, higher learning facilities there in the general area to see if there's individuals that are working towards their degree in social work that may be interested in working there as well. But once again, that's something that you're going to have to do, and you're going to have to do it on a consistent basis. And what I mean by that is that even by doing that, there's no guarantee that those individuals are going to come. There's no guarantee those individuals are going to provide you the quality level of work that you need. It has to be within the individual to want to do the work, to want to be there, to want to do that type of work. I can develop the skill. That's no problem. Alicia, I came up and did a training there for you guys quite a few months ago. And all the county staff were there, from Taylor and Iron, and all of them were there. And it was a great training. The kicker is that I can train. If you're not going to take it and implement it, then there's a problem. And what I mean by take it and implement it, I mean the individuals that I'm training. So those staff members that are sitting there have to say, okay, yes, I can do this. This is the right way to do it. I got it. I gave examples that made it crystal clear and as easy as pie. But if a person isn't willing to do that, then that's where your problem is going to come in. And so you have to ask yourself one simple question. Do I keep an individual on just to say I have a service facilitator? even though this individual is not providing me quality work and is not pulling their load, is doing 50% of what they should be doing, I consider that individual to be a liability. And I don't want any liabilities, because liabilities lead to you getting caught in an audit due to something that they didn't do. You want someone that's going to come in, that's going to do the work, that's going to meet the requirements, and it's going to be consistent in doing it. I mean, and that's the individuals that you have to reach out and find. So, I mean, you know, you've got some local universities there. You've got some individuals that may be in some social work programs there. I suggest that maybe you reach out to them and see if anyone is interested, anyone with bachelor's degrees that are interested, or individuals just in college. They're just in college. They don't even have their degree yet, but they're interested in doing the work. They're interested in the field of human services and social work.
Langston,
Individuals that you want.
Langston, you recall the conversation you and Cheryl I had today? I was concerned that this might come up, and I want to really be clear with the board. Are you suggesting that high school students or people with a non-degree or an associate degree can become a service facilitator?
That is correct.
Cheryl, what's the criteria for NCR?
We prefer that they have a bachelor's degree. From a Chapter 36 perspective, they don't need that. However, we have found that the abilities of someone and the skills of someone, they needs to have that bachelor's degree so they're able to document, so they're able to understand clinical issues that come up, so they know what to do if a person becomes suicidal, so they know what to do if a person is in crisis and how to link them up. So from a detail point of view, somebody who doesn't have a degree can perform that. What I worry about as an administrator is the quality of that work because of the amount of training that they will need. Social work is a profession, just like nursing.
Correct.
When you graduate with a social work degree, there is a set of skills that you have. When you graduate with a nursing degree, there is a set of skills that you have. And when you are employed, you are expected to do those, to be able to do those skills. That's why we say we want a bachelor's degree, because they have a set of skills that comes with that. They have done internships. They have done time with consumers so that their ability to interact and establish relationships is present. And establish a professional relationship with appropriate boundaries.
Right.
That's the biggest issue that we deal with when we have providers who do not have degrees, is they want to be friends with the people on their caseload. You cannot be a friend to someone on your caseload. You cannot do that. That is unethical. That will get you in a world of hurt.
That is correct.
You need to have that professional degree so that you have been educated regarding what those boundaries are and what you can and cannot do with your consumers. That's why we say, although from a technical point of view, you don't have to have it, I would be extremely concerned hiring someone who did not have a degree or was not well on their way to getting a degree. Now, this is a time of year where you may have graduates coming in May or even later this month. Those people I wouldn't be as concerned about because they are well on their way. Hiring someone who is a freshman or a sophomore where they really haven't had any of the classroom skills would concern me very much.
Okay, Dawn, say something?
Yes, I wanted to take this time and address Mr. Schuman and Ms. Gouget. We know that the tribal college is sitting right next to the clinic, and this board also knows that the college is within our boundaries. We should be looking at within and promoting our Native American students for these positions. And we should be guiding our college participants at the LCO college into these positions. We need to be more diverse as we sit across the county. We need to be working together. If the clinic has a CCS facilitator, that county should be working with that facilitator. We should be we should be working together. It frustrates me knowing that we have the college sitting there and we have people in bachelor's programs for social services and human services, and maybe trying to get them some internships or whatever they need, the training they need, even if they shadow somebody to try to pick up on this job if they're a junior or a senior, to develop their skills. Because we'll be in the same situation come one of the therapists go, what are we going to do? We have no one that is qualified within our community. No one is stepping up to the plate. That's my big thing. We have a college where we need to promote within, and that's the issue. We don't. We have the opiate crisis. We have people killing themselves. There's jobs here, but we're not focusing on what we really need to do and be pushing to get these students into the jobs. So I would ask that, reach out to the college, the dean of students and the dean of faculty to see what we can do, and we'll all work together.
Okay, thank you. Dale Olson, you there? Mr. Olson?
Can you hear me, Mr. Chairman?
Yes, go ahead.
Yeah, I wanted to make sure that the long answer short there was that no, a degree is not required. And I certainly understand, and I'm so thankful we have these experts in our midst, but we have to do what we have to do for Sawyer County. And I'm kind of in Ms. Pettit's court that we have to look within, and there's opportunities within. That's all I can say. Thank you.
I agree with you, Dale. I'm wondering, for data entry and doing these papers, filling out the paperwork, you don't have to be a licensed social worker to do that, do you?
No.
There's college kids, high school kids who graduate that are incredibly detailed. You probably guess I was one of them, but it does happen. Chuck has his hands up. Chuck, please go ahead.
Mike, I appreciate the board. I appreciate everybody that came in. My question's more directed to Alicia and Paul, and I want to go back a little ways, and I'm understanding the hard placement of the CCS and whatnot. But at the beginning of this, when we had some people speaking, and I've received emails and text messages this week, and it's all about attrition. And so my first question is two parts. My first question is, how much attrition within the department, not just this CCS, has gone through, and why can't we visit the qualified people that have left us and work on getting them back if they already know the procedure, they already know what's going on. And so from my understanding, there is a lot of turnover. And, and again, this is the law enforcement coming out is if we have one turnover, we have two, it wasn't a good fit, we have three, we have four. But when we start talking high volumes of numbers, the buck's got to stop somewhere. Someone needs to be responsible for this.
Is there another question you had there?
So my question was, how many people have we turned over, and are we doing anything? Do they do exit interviews? Is there any kind of some kind of tally of what's going on? Did people just decide that it wasn't for them, or did they take a better job? They're still living in this community. Can we recruit them back? Is it obviously if someone was fired for malice or misappropriation or something major, we wouldn't want them back. But if we've got well-trained people that used to work here and we just had a personality conflict, I would like some numbers. I would like to know how much turnover we have had in the last, say, 5 years.
I don't know the answer to that, Chuck. I assume we can get that emailed to us at some time in the near future.
I just wanted, Tom Hoff, County Administrator, just wanted to respond. Yes, we do exit interviews for individuals who leave us, and we do learn information and pass that back to the department. And in fact, we've had several meetings recently about that and what we can do differently. But yeah, if people left on good terms and they would want to come back, we would certainly open the door and talk to them again. So, these advertisements for these jobs are out there. If there are people that have been employed in the past and are in good standing, we would certainly like to talk to them, yes.
Okay, any further discussion?
I just wanted
Did you have
to
something, Lori?
make a quick comment on Don Pettit's remarks there. I strongly support that because we do have our campus and it's growing. We're going to be offering those bachelor's degrees. We're expanding now, and we want to have our people have those opportunities as a pursuit of that education, and they need that experience, and we need them. So the president we have at the college campus right now, very open to things, opportunities for our students, and we'll work closely with whoever who would like to work with them in pursuing these partnerships or encouraging our students. That is one of the degrees that's offered: Health and Human Services, Social Work. And then we're going to be expanding more. We're looking at a full campus and university level, so we're growing. And our people need those careers and opportunities we have here. And we can grow our own. That's our philosophy. So.
That's great. Okay, move on to number 7, public health.
Oh, Mr. Chairman, can I?
No.
No.
Yes, go ahead.
Excuse me, Mr. Chairman, may I make an additional comment? This is Cheryl.
Cheryl, I had one more question for you. I'm sorry. I was just trying to clear my throat. Cheryl, at Taylor County, you have service facilitators that wear several different hats, it seems. They're part-time in that position. They also supervise other areas you talked about. What's the chance that we could, we have Alicia who sounds like she just stated the art for this position. Could she also be a service facilitator as part of her role right now, and then supervise like CTLS or whatever else she is doing, at least until we can recruit some other people to assist with that?
To answer your question, in the very short interim, Alicia would be able to function until someone is hired. It is not something we prefer. It is not something that can happen long term. or we will lose our certification. The purpose of having a multi-tier system, of having people who do the work and people who supervise, you cannot supervise yourself. Cannot. State will say no, and we will lose our certification. In the short term, until somebody else is hired, yes. And I have also looked at our policies and procedures for our NCR CCS region, and we do require a bachelor's degree. Now, in order for that to be changed, it would have to go through our NCR CCS committee, and it would have to be approved by the state. I would be extremely hesitant to do that for the reasons that I have already said. I think we could make allowances if the person was near graduation, internships and things like that. But hiring someone who is does not have experience from a professional point of view, I would not want them to be responsible for CCS, because I believe that's setting the county up for potential problems with an audit.
It could, Cheryl. I will agree to that. You made a very, very good point by pointing that out, and it very well could. I think that you do have a very good point, Dawn, in reference to drawing from the resources that you have from within. Unless you have something else going on where you have people that are in school, in college, pursuing a degree that's close by. If you have some people right there that are pursuing college degrees, especially in social work, that may be a good avenue to take a look at.
The other thing the county may want to look at is, because our programs, our counties are small, and like I said, our service facilitators here in Taylor County cover work in other programs. Those other programs also require a bachelor's degree. So if you hire someone who does not have a bachelor's degree, there is a very good likelihood that they will not be able to perform other functions in the programs that you need them to also do, because they don't have that degree. So I would just caution you in hiring someone without a degree or very close to having a degree. That comes from experience in knowing the Children's Long-Term Support Program. I've supervised that for 8 years. And I would be extremely cautious before I hired someone who didn't have a bachelor's degree. And I would want to check with people at the state. As the supervisor, I would check with people at the state to see if I could even do that. Our county board wouldn't do that. They would ask me to do that.
Last question, I promise.
I promise too.
You can ask as many questions as you want.
This is Cheryl and Langston. You were gonna share with us CCS as a diversion program, because you talked about it being a rehab program for consumers trying to better themselves and route to recovery and those things. So can you share with us CCS as a diversion program?
Actually, Tweed, I provided you information to an individual that I'm aware of that has a fantastic drug court program in Manitowoc County. I believe I gave you the contact information for the director there. Her name is Lori Fury, F-U-R-E. And the supervisor for their drug court there, his name is Jason Latva, L-A-T-V-A. And they do have an exceptional program there. I don't think it's the type of jail diversion that you're thinking of. I think that you should probably contact them to find out how they operate their program. My understanding is that CCS is offered to them. It is not, there's no level of coercion taking place. CCS is a voluntary program, so it cannot be used as an option of either you do this or you get this. That would really put the county in a bad situation by doing that.
So no court orders, and no condition of probation to be a part of. Yes.
No.
I want that clear to the board. Okay,
No,
for
it
diversion.
cannot, no, none of that.
Thank you.
No.
That answers it.
How-
Thank you, Langston.
How CCS can be used in a way is similar to what I had said before. By providing the CCS services, you are diverting people from going to the hospital, to Winnebago. That is the type of diversion that CCS can provide, is you are diverting them from receiving a higher level of care, because we can provide more services to them in their home to help them through a crisis.
Now, what you can consider is that, let's say, for instance, you have an individual that is struggling with a substance abuse issue and they want CCS services. They can come in, they are MA eligible, they meet the requirements on the functional screen, they go through the assessment process. What CCS is made to do is to help that individual put their life together better than it currently is. And by doing that, they ask the individual what that individual's goals are. And they work with that individual to achieve those goals, whether it's to be sober, whether it's to get a job, whether it's to move out from their mom's house and get their own place. It could be a host of things. But that's what the CCS program is for, is to help individuals reach those higher levels within their life and achieve those goals. Along with that, in many cases, individuals get to a point that they step away from the drugs. If it's a mental health challenge, they learn to manage their mental health in a different way than they've managed it in the past. And it helps individuals reach a better way of living.
Langston, you said something that's really key, is we talk with people about what their goals are. And that is a critical part of CCS. The person is at the center of the program. It's their goals that we work on. It's their plan that we work on. It's not what we think is best for them. It's what they think they want to work on. Now, there may be times where we think it would be a good idea if they work on something else. Our hope is that through working on things that they want to work on, that they will then see those other things in their life that could possibly be contributing to certain things that are happening to them. So voluntary investment in the program is critical. And that's why CCS cannot have court orders to be in the program.
No.
Okay. Thank you very much. We do need to move on. Is Julia here?
Yes, I am. I'm sorry, Mr. Chairman, I could hardly hear you. Okay. I am going to, oops.
1 second.
Yep, thank you. He disabled me.
All right, you should be good now.
Okay. All my icons on my screen. Okay, well, we're going to make a transition to COVID. I almost hate following up on this discussion because it's such an important program, and I just want to take a moment to to just comment that with everything happening with COVID, the drug issues and everything that's happening in our community have really become greater. And it was very interesting to listen to everybody talk today. So thank you. Moving into our COVID update, I'm going to keep this nice and short and sweet for you guys tonight. We are up to 981 positive cases. We just received our 8th death this week. 39 people have been hospitalized. We have 10 probable, and we're only monitoring 37, so it's a very low number. And so as we move into the information, you'll see some good and some craziness here. You can see over the month of November, we had quite a high level of cases coming in. This is using the Harvard Global Health Institute 7-day moving averages. And right now we're at 68 cases per 100,000 per 100,000. The last time I reported out, we were at 49.2. So we're at 68 now. We were at 49.2. Our high in between, we were up to 135 per 100,000. So that's where you see that big spike there in November. Right now, we're averaging 11.3 cases per day. I'm expecting that to be going down. The last time I reported out, we were at about 8 cases per day, and our high, we were averaging 22 cases per day. So we had a crazy November since I've seen you guys. And this is another chart just to show you what has happened over that last month. In July and October, we had reported cases of 275. Oh, my chart looks a little funky. Now in November, we had 489. So we doubled those in that last month. I just want to go over something that looks good, even though we have this high spike that we're seeing in November. And we were increasing in the, and just to kind of backtrack for you so you can understand what this graph is, this is a 7-day daily average. And so we're starting off week by week looking at that daily average and then looking at the new cases per day, and that's a 7-day moving average. The blue line is the 100 per 100,000, and the yellow line is the percent change. Actually, we don't even need to say percent increase. That's what was happening for a while, but it's actually the percent change. And as you can see in the last 2 weeks, we are actually coming down fairly drastically in our percent changes, which is something that I am cautiously optimistic about. And leading into my next slide, I was talking today on a meeting. Tom and Tweed had heard me, and I was looking out at the lake, which is frozen really nicely, and it makes me want to go ice skate across the lake. But right now, you know, do you dare go out there, and what does that look like? And so this is where I feel right now with COVID. We definitely are still in a high count, but our numbers are coming down nicely. Question is, why is it coming down? I think that it's a bundled reason why. Could it be better masking, improved physical distancing? I think people were getting concerned when our numbers were getting so high. The other piece is do we have enough people that are starting to gain immunity that are the ones that are out in the public more often? We also had schools that went virtual, and there is that percentage of people that are choosing not to be tested despite that they're sick. So all of those things could be placing us into those numbers coming down. We will look at one more week. It's always good to have 3 weeks of data of a downward trend to help you know that you're on the right track. And then I have good news that's also taking place is the National Guard testing in winter has been extended. The National Guard was opened up and was going through December 10th, and they have been extended. And we got our site authorized in winter to be extended through March of 2021. And that does happen weekly on Wednesdays from 9 to 1 p.m. at the fire hall. And then the other thing, I did note that Lorraine was talking about the vaccine disbursement. It is quite new for us. I'm on calls about 3 times a week, looking at what that looks like. Like she had mentioned, for LCO, we are going to be focusing on healthcare providers and long-term care providers and residents. So that is kind of the first wave, and the federal government is working on helping to delegate where the rest of the vaccine will go. So I told you I'd keep it short and sweet for you. Does anybody have any questions for me tonight?
I do.
Dawn! Yes, what can I help you with?
Since I spoke with you this morning,
yes,
I saw Dr. Fosse's report, and we had looked at the data as the 11th, but he's saying they go really through a 2.5 week, which will put us right into the Christmas. And his report today was, he was very concerned about going into the Christmas holiday. We're going to be right at that threshold from Thanksgiving and then going all the people traveling. And he's fearing December to January. January is probably going to be our worst month. Are you of the same logic or feeling? Or
I was, and Dawn, here's my talk, because we communicate on LCO College, so that is a very important facility to be looking at.
Yes.
I was very, very concerned going into hunting season and Thanksgiving. I was expecting to see a jump up, and we did not see that. And so what I'm looking at right now is I'm going to look out a couple more days to see what happens, but we do not seem to be experiencing that jump up. And so, you know, those are based on some of those questions I have. Did people really change their behaviors for Thanksgiving? For hunting season, did we have less of our own residents congregating together? We know we had some increases through hunting season, but we also know they weren't residents of ours, so they didn't reflect in our numbers. So if we can keep, if it is a behavior change, and this is all a if, because obviously we aren't able to do research on this, but if this is a behavior change and we're able to maintain it through Christmas, we could end up with a fairly similar effect to what we have right now. We will see what happens when schools open. That is my biggest concern. Schools are back in place now. One of the things that has been talked about a lot is the fact that schools have been out. A lot of kids at that age tend to be asymptomatic. Are they spreading more than what we realize? And that is an unknown because we just don't test them enough to know that. So as schools start to be in person more, if we see that number jump, that's probably going to be an indicator that that is a risk. And then that will impact what we decide to do after Christmas. Kind of a roundabout answer for you. Hopefully I answered that to meet your needs.
Yes, you did. And thank you for everything you do.
Thank you. Anybody else?
Julia,
yes.
When the information came to the tribe, and I'm sure probably everybody knows, but me not, it was interesting to find out that the vaccination was for 18-year-olds on up.
Yes.
And nothing for the younger age yet. So we'll have to watch when, because they're still testing, doing things right now. We'll watch when that time comes.
Yeah, and I can answer you a little bit on that, Lorraine, just so everybody is aware. There has not been testing on anybody under age of 18, so the vaccine will not be administered to anybody under age 18. And again, I'm sure this is part of kind of the whole research practices as we move forward, doing this fairly on a shorter timeline than we're used to, because we're doing everything rather than linearly. We're kind of compacting different research at the same time. That's what is making this vaccine safe, is that we're still doing all our checks checks and balances along the way. But they're not doing the research on that younger age. The other piece of that is we haven't found that there's as high risk of health concerns with that age. But to speak to the K through 12, one of the things that we are looking at is hopefully the federal government will help endorse us to be able to vaccinate K through 12 teachers early on. So because that is really part of the reason why our schools have had to go virtual is quarantining our staff.
I just wanted to comment too, that a couple of those cases, they had gone somewhere and came back. And I still have that concern with the bar scene. I just think there's a lot of unsafe behaviors that continue. And yeah, and we've got to keep educating and keep encouraging and keep working together.
Yep. I'm hoping we have some herd immunity in some of those groups right now.
Thank you, Julia.
Yeah,
thank you.
Okay. Any question? Discussion over.
Well, Mr. Chairman, getting back to the budget real quick with Patty here. Do we have enough money in that fund to cover the out-of-county placements that we were talking about for this year? Will there be anything left for next year?
That's really hard to say at this point in time. Right now on your purchase service recap, you can see that Winnebago is at $719,000 that we spent. Even though this is a report through October, the state is 3 months behind in billing. So this reflects expenses through July on Winnebago. So $719,000 through July. However, on the very good note, Joe Bodo relocated one of our long-term residents from Winnebago to another facility in November. We're crossing our fingers.
With the
that it will
help
work.
of Caroline.
Yes.
She was very involved in that.
Wonderful.
So it's early. We're crossing our fingers, huh, Carol? But I mean, I don't know. I mean, but it will still cost us. Just hopefully not $1,300 there. So.
Any other items? We're adjourned.
Thank you, everyone.
Take care, everybody.